I now call this regular meeting of Davenport Community School District Board of Directors to order. Would everyone please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Director Kleindrome, would you please read the board priorities?
The Davenport School Board establishes the following priorities to ensure the academic success of all students. Provide leadership and direction to improve the overall learning environment in our classroom, schools, and district, including the health, safety, security, and happiness of students and staff. Direct and support actions, programs, and activities which reduce the impacts of poverty on our students, their families, and our community.
Thank you. Director Beck, would you please read the mission and vision statements?
Our mission statement: enhance each student's abilities by providing a quality education enriched by our diverse community. Vision statement: education that challenges conventional thinking, prepares all students to compete in a global society, and inspires our students, parents, staff, and community to answer the question, what if?
Thank you. Ms. Weinzero, would you please read the goals the board will be going over tonight?
The two goals are demonstrable progress and disproportionality, and the emphasis on student achievement.
Thank you. Just for everyone watching, Jamie Weinzero is sitting in tonight for the superintendent. He is on vacation this week. Also, Director Gordon is not here tonight. She is on vacation, and Director Potts is not in attendance at the moment. First order of business, presentations. Our first presentation, I get to award this awesome trophy that I came up with 2 years ago when I became board president, the Traveling Trophy. It's to get the families more engaged and involved during graduations. It's been awesome. It transpired into way more than I ever thought it would have been, but it really gets them engaged and active, and I love seeing it, and then I love going back and watching the videos of it too. But we have in attendance tonight Principal Corey Williams from West, because West did win, and you did a great job hyping up your parents and students. It was awesome. Hopefully that catches and grows a little more. So if you want to step on down, I'll hand you your trophy, and then we can do some photos. And if you want to talk about it or anything, feel free to step to the podium. All right. All right, thank you. Congratulations. All right, up next, our next presentation is on community healthcare partnerships. Am I turning it over to you?
So community healthcare has been a great partner with the Davenport Community School District over the 21-22 school year and helped a lot with activities, health-related activities down at Smart Junior High. And so I believe they're here today to talk about some great grant opportunities and additional opportunities that they have to support even more of our students here in the district.
Can you hear me? Can you hear me? Is that better? Okay. All right. Well, hi, everyone. My name is Gone Job. I am a RN at Community Healthcare. I've been with Community Healthcare since 2018. I've been a nurse for 6 years now, started my career at the University of Iowa Children's Hospital, and then came to CHC as a pediatric nurse. I worked at the CHC in Rock Island, and I love working with students. I love working with families. While I was at Rock Island, I was able to build. Perfect. While I was at Rock Island, I was able to build a lot of partnerships with the school nurses in Rock Island, which has really helped me in my role today. So I'll go ahead and get started. Okay, so community healthcare, our mission is to provide the communities we serve with excellence in patient-centered medical, dental, and behavioral health care that is compassionate, affordable, and accessible. So community healthcare, we've been around since 1975. We are currently in 4 counties: Rock Island, Scott County, Clinton, and Muscatine. We have about 10 locations. The majority are in the Quad Cities area. In Davenport, we have the CHC Davenport Clinic, Dental Clinic, and Edgerton Women's Clinic as well, and then others throughout the Quad Cities. So our services, we provide medical services such as pediatrics, family practice, internal medicine. We do lab work. We have our own pharmacy. We had chiropractic at one point. We do pain management, OBGYN, and telehealth. And in addition to those services, we also have a behavioral health team, which includes therapists, social workers, and nurse practitioners that do medication management. We have a home healthcare for homeless program, so we have an outreach team that will go out to different shelters around the Quad Cities and actually provide that care to them, so meeting our patients where they are, as well as a substance abuse screening and referrals. As far as our dental services, we can do pretty much anything preventative, and whatever we're not able to do, we refer patients out to other specialists. We have interpreters, we have community health workers. We see a lot of different languages at CHC, so we try to have our CHWs be people who represent our patients, so people who speak Spanish, Swahili, Karen, Chen, and they really help those patients get the services that they need, and then transportation as well. The great thing about having our own pharmacy at CHC, we offer a sliding fee discount. So patients who may be on Medicaid or uninsured, they can apply for this discount. Really, anyone can apply for this discount, and they're able to use that discount at our pharmacy to get a discounted rate on medications. There we go. Okay, so school-based healthcare, like I said, CHC started this program last year, and we partnered with SMART. SBHC, or school-based healthcare, delivers comprehensive health services where students are in the schools. It promotes access to healthcare and reduces absenteeism due to health reasons. Our program is more of a school-based telehealth program, and it offers convenient access from various specialties to multiple schools. Our focus is whole school, whole child, and our vision is that graphic you see in front of you. So we're doing kind of like a phase-by-phase approach. Currently, we are working on phase 3, so phases 1 and 2 are up and going. Phase 1 is preventative health. So we utilize our mobile clinics or mobile units, and we travel to the schools to provide physicals and immunizations on site. Students that we see that do not have a medical home, we get them established with one of our providers at CHC. In the 2021-2022 school year, we did a total of 8 physical and vaccine events for a total of 6 schools, including SMART. We serviced over 400 students and staff with physicals, immunization, and COVID vaccines. So there are some pictures, and there's our champion, Principal Chad, who's been a great help last year. And then that's an image of what our mobile unit looks like. Phase 2 is health management. So through telehealth technology, we take these kits out to the school. They're called Dictum, and we're able to conduct visits for students. So students that have any chronic conditions can have their appointments done at school. We have myself, a nurse, or a medical assistant go out and we'll do vitals with the kiddos. And then with this technology, the providers connect virtually and they're able to listen to the kids' heart and lungs. They're able to look in their ears, look in their throat. They can do an exam just as if the provider was there in person, but everything is done virtually. So it's pretty cool how far technology has gotten. So this is not us, but this is kind of an image of what the visits would look like. So we're with the student, and then on the tablet you would see, you know, what's going on. So if we're looking into the ear, that presents on the tablet, and the provider's able to see the same thing. This is our current telehealth menu, so we are able to manage everything from ADHD, asthma, allergies, to some behavioral health as well. So if a student is undiagnosed or unmanaged and needs just to see someone for behavioral health, our providers can see them and refer out as appropriate. In the future, we hope to provide behavioral health as well. And then for kids who are 12 plus, so 13 for the state of Iowa, we also provide confidential sexual health visits. I'm gonna get this. Okay. Phase 3, which will be coming soon, our goal is to prioritize the school's social and emotional health. In doing so, we will provide telehealth counseling and psychotherapy, so that's appointments with our psych nurse practitioners to do medication management. And then we will have a behavioral health specialist who will travel to the schools to be able to conduct those referrals and help families get those behavioral health care that they need. Okay. And I always like to ask our school partners if they're ready to be a partner. We are whole school, whole community, whole child focus. Our program is a collaborative approach between learning and health. We're there to promote health care to students, promote health promotion. We also do health education. So this school year, I'll be reaching out to the middle schools to see if they're interested in having us come out, like our Edgerton Women's Clinic, come out to do some sex education for students and just letting them know how to get resources if they need those. We do education about dental services, really anything around health education we can educate on. We're looking for active student recruitment and referrals, so working closely with the school nurses, counselors, teachers in identifying those students that might need our services and getting them connected at the school. And then we're hoping for staff, student, and family engagement as well. With the program, consent is the number one thing, so we always want to make sure we have consent, and then keeping parents informed of everything that we do with their child at the school. So just engagement is key, and the program is only as successful as our partnership. Any questions?
So I'll just tell you a little bit about where we're at with this here in Davenport schools. Last year, we piloted the program at SMART, and on Jumpstart Day, they did have a clinic at SMART where children could get physicals completed and received their vaccinations, those important 7th grade vaccinations. And we started with that, and then we opened it up to some of the telehealth during the school year. When other principals heard about it, there was a long list of everybody that wanted the same program at their school. And so we worked really hard through the spring, and this year we will be offering the program at Smart, Williams, Wood, and Sudlow. Going to look a little bit different because Jumpstart is the same day at all 4 of those schools. So this year they will be hosting a day where children can come get their vaccinations and their immunizations, students from those 4 schools, on the 13th of August down at Community Healthcare. And then kids who need it beyond that will make appointments for them to get in, and CHC will come out to the schools and help with that as well. So I would say it got a lot of kids at SMART last year who were not immunized to be able to attend school in that first week, which was wonderful. And then we also noted that it keeps kids in school. So where kids sometimes were getting picked up to go attend appointments and then never came back to complete their school day, now they're only out of the classroom for about 20 minutes. And then they're right back in the class. And the community health does that, a virtual appointment, and parents are given the opportunity to join that virtually or to come to the school if they want, or to not if they choose not to. And then CHC follows up with them after the appointment if they're not available during that appointment time. So, any questions?
Director Hayes.
So the school nurse would schedule the appointment, and how are the appointments paid for?
Great questions. We work with the school nurse to get appointments scheduled. So if the school nurse identifies a student that has a health need, they can reach out to me. We are in frequent contact, so they can reach out, and I'll make sure that we have consent prior to seeing the student. Once we have consent, the school nurse can request appointments, the parents can request appointments, and then we will communicate about follow-ups as well. And as far as payment, we bill. So if they have insurance, we will bill their insurance. If they do not have insurance, we will help them to get insurance. And we take state aid, we take private insurance, we take self-pay. But for the students, we really want to make sure that they get insurance if they don't have it.
Okay, now what's the turnaround time for an appointment? Are you waiting weeks or?
No, we don't have a wait list, so we can see a student within a couple of days if needed. Yeah, our providers are pretty available due to telehealth. So that's the great thing about this being telehealth, is that we're able to have more availability to the schools.
Okay, thank you.
So with the pilot program at SMART, you said that you did the immunizations on Jumpstart Day, and I wasn't quite clear because I know trying to get people to come somewhere another time is really hard. Will you be scheduling those appointments at Jumpstart Day this year?
Yes, we are planning on being at all 4 schools at Jumpstart Day to pass out flyers and then to schedule anyone who would like an appointment done that Saturday. And then the plan is to follow up with the schools after, hopefully before the first day of school, to see how many more students we need to capture before that exclusion date.
Okay. And then my other question, so based on how many students did you guys end up serving at SMART? Like, was it, a couple a day? Were there, 50 appointments a day? I don't need exact numbers, but it sounds like it was fairly successful.
Yes, so I believe we did a total of 45 for SMART. The first couple of events we did, it just took a lot of communication, letting people know what to expect. So parents have to be there. If you have insurance, bring your insurance. And then we were there during, was it SOAR? Is it SOAR? Yeah, SOAR. So it was only a couple of hours. So we're limited on how many kids we were able to see, but we did do a total of 3 events. One of those was actually during the school year where parents consented but weren't there. We saw the kids and then communicated with the families after, and that one was pretty successful. Okay. So we have ways to work with families if needed so that their child gets what they need.
Okay. So basically, if a counselor sees that a child needs some care of some sort, they can reach out to the family, and if the family doesn't have a practitioner, they can then refer to you guys.
Correct.
Awesome. Thank you.
You're welcome.
Thank you very much for the presentation. Thank you for all the work you're doing to help out with our schools, and it sounds like it's a good partnership, so thank you very much. Board reports. Are there any board reports? Director Poston?
Last Wednesday, I was attended a summer school session at Madison Elementary, and I wanted to thank Mr. Sneeden, teachers Dugan, Jossert, Clymore, and Luntz for allowing me to sit in on their classes, and to Shaney Ford and to the AmeriCorps workers, Dante and Jordan. They are football players from St. Ambrose that are working at Madison through the AmeriCorps program. Again, these kids just idolize these guys, just great young men. I'm so impressed with the work that they do there, and the kids just adored having them there. So it's just such positive role models, and hopefully they can continue to do that type of work through AmeriCorps.
Thank you, Director Poston. Ms. Winesboro.
I would like to introduce the man in the technical closet over there. Is Tim Longoria is now helping the school board with all the technology during our board meetings, and I just wanted to introduce him and welcome him and thank him for jumping in and keeping our technology going during these meetings. Thank you.
Thank you for the introduction. Any other board reports? Seeing none, I'll move on to communications. Open forum. Perfect. All right, there are no open forum requests for tonight, virtual or in person. So we will move on to the consent agenda. May I have a motion to approve the consent agenda?
Mr. President,
Director Hayes,
I move the board accept the consent agenda as written.
is there a second?
Second.
Seconded, Director Beck. Is there any discussion? Seeing none, I'll call for the vote. Director Hayes,
Yes.
Director Beck,
Yes.
Director Poston,
Yes.
Director Klein-Jerome.
Yes.
My vote is yes. Motion carries. May I have a motion on approval of bills?
Mr. President,
Director Beck.
I move the board approve the following resolution. Resolved, all claims presented to the board having been duly certified as correct by the treasurer, reviewed by the administration and board members, and they are hereby audited and allowed as just claims and warrants drawn on the treasury for the several amounts. Further resolved, the payment of claims and salaries be approved as presented for the periods of July 6, 2022 to July 19, 2022, noting voided check 379735 because of a duplicate invoice submitted.
Thank you. Is there a second?
Second.
Seconded by Director Hayes. Any discussion? Seeing none, I'll call for the vote. Director Beck,
Yes.
Director Hayes,
Yes.
Director Klein-Jerome,
Yes.
Director Poston.
Yes.
My vote is yes. Motion carries. Superintendent report.
We have none at this time. Thank you.
Thank you. Committee reports. Data Wall Ad Hoc Committee,
None at this time.
Finance Committee.
We met last Thursday. We reviewed our Pebble and Save funds, and then we also discussed funding for our long-range facility plan.
Thank you. Legislative advocacy, we met and went over the priorities for the UEN, RSAI, I think I said that one right, and IASB. Is that on this one? Is that on at the next meeting? We're gonna talk about those or this one? Okay. So we kind of narrowed down the search, and that's what we'll be going over tonight. Long Range School Improvement Advisory Committee, we have not had a meeting since our presentation at the last board meeting. We'll have one this Friday. LZAC,
They're on hiatus for the summer.
Policy Committee.
We have a batch of policies coming up tonight that were discussed twice. Basically, in our first iteration of shifting over to the Iasb numbering situation, we had a slightly different system and we had some different staff in place. So we did board discussion 1 and 2 for those policies, but we never actually did a vote to approve them. And so they are up tonight in case anybody's wondering why we have so many available or tonight. Otherwise, we are continuing on with our process.
Brenda, do you know, is the numbering going to change because the ISB uses Assembly now, or it should stay the same? Okay. Okay. I wasn't for sure. I think I got all the committees. We'll move on to items requiring action. May I have a motion on subject 10.01, approval of equity coordinators? Director Beck.
I move the board approve the Title IX equity coordinators as presented.
Second.
Seconded by Director Pasha. Any discussion? Seeing none, I will call for the vote. Director Beck,
Yes.
Director Pasha,
Yes.
Director Klein Jerome,
Yes.
Director Hayes.
Yes.
My vote is yes, motion carries. May I have a motion on subject 10.02, approval of level 1 and level 2 investigators?
Mr. Chairman,
Director Pasha.
move the board approve the level 1 and 2 investigators as presented.
Is there a second?
Second.
Seconded by Director Klein Jerome. Any discussion? Seeing none, I will call for the vote. Director Pasha,
Yes.
Director Klein Jerome,
Yes.
Director Hayes,
Yes.
Director Beck.
Yes.
My vote is yes, motion carries. May I have a motion on subject 10.03, approval of LEA homeless liaison?
Mr. President,
Director Beck.
I move that the board designate Shaney Ford as local education agency liaison for homeless children and youth.
Thank you. Is there a second?
Second.
Seconded by Director Hayes. Is there any discussion?
I do have a question. Who will assume the position that Shaney's had before, or is this just added to what she's currently doing?
This is just being added on to what she's currently doing, and it's been discussed she has capacity and was willing to do this
To do
work. Mhm.
Okay, thank you.
Any other discussion? Seeing none, I will call for the vote. Director Beck,
Yes.
Director Hayes,
Yes.
Director Klein Jerome,
Yes.
Director Poston.
Yes.
My vote is yes, motion carries. May I have a motion on subject 10.04, policies for board approval?
Mr. President,
Director Beck.
I move the board approve the following policies: 200.01, 200.02, 201, 202.01, 202.02, 202.03, 202.04, 202.05, 205, 206.02, 207, 208, 209.01, 209.02, 209.03, 209.04, 209.05, 209.06, 209.07, 210.01, 210.03, 210.04, 210.05, 210.06, 210.07, 210.09, 211, 213.01, 215, 216.01, 216.02, 216.03, 217, 300, 301.01, 302.01, 302.02, 302.03, 302.04, 302.06, 302.07, 302.08, 303.02, 303.03, 303.04, 303.05, 303.07, 303.08, 303.09, 304.01, and 305.
Sure you don't got any more?
Second.
It's been seconded. Is there any discussion?
I have a question for Brenda on 303.05. One of the bulleted points is for administrators, instruct teachers to make a complete annual inventory of all school property contained in their individual rooms, which would be a nightmare. This inventory is reviewed and filed with the board secretary. Do they file it with you, or is there somebody else that is keeping track of this? And
what I'm assuming is that is an inventory, and Josh, you can probably help too, that's taken by our operations staff and or purchasing staff. I'm not sure who they report to, but we do have inventory control.
There are asset tags on equipment and things in the room, and those things are kept track of by the warehouse staff. I'm not deeply involved in that part of the warehouse and stuff, but I know that if we dispose of a desk, for say, we have to go through proper channels to get rid of it, so we can't just give it to somebody or just throw it away. We have to put it up for public auction unless it's completely destroyed or something like that.
but also I know books have to be inventoried. I remember scanning every barcode on every book I had in my room. But you wouldn't get that, would you?
I do not.
Like, who's this really going to on file? Because it says the board secretary, and I think if it's not, we need to correct that.
I agree. Go ahead, Kevin.
Textbooks are managed by our textbook adoption folks. It's purchasing the same person. There's inventory that are capital assets that we capitalize, and there's inventory of desks and chairs and the like. That's usually kept with the principal, so they know exactly what they have for desks and chairs and cabinets, those kind of items. But the items that are capitalized, we keep track of in accounting and purchasing.
So where it says the inventory is reviewed and filed with the board secretary, who really is it being
I think we would
filed
adjust
by?
that to superintendent or superintendent's designee, because that would encompass all of the different departments that have that.
Whoever he
System.
designates do it.
Pardon?
We could do that. We
Or-
could say with
yeah.
the business office.
So
It's more like
that's what it should be. I think it's just basically because nobody's submitting a report that we approve to you or anything like that. And since it's multiple different locations because of the different types of assets, I would say superintendent or superintendent's designee, and that would encompass where it's filed.
Okay. I will make that change. And do you want me to bring it back, or is that
That's
not
good enough
substantial?
as long as it gets changed.
Perfect. I will do it.
Do we need to make an amendment?
Director Kleindrom, do you want to make an amendment to the
Brenda shook her head and said we don't need that.
We don't.
You don't? You're good? Okay.
Okay.
All right, perfect. The motion's been made and seconded. Is there any more discussion? Seeing none, I will call for the vote. Director Beck?
Yes.
Director Poston?
Yes.
Director Kleindrom?
Yes.
Director Hayes?
Yes.
My vote is yes. Motion carries. Discussion items. First item of discussion is 11.01 Recovery Health of Iowa Nursing Contract.
I believe I will be turning this one over to Courtney.
Good evening, everyone. So this is a contract we have with Recover Health so that we can provide nursing services that are outlined in a student's IEP. Yes.
Director
I'm
Beck.
sorry.
So, two questions. Does this typically apply to students who need a physical nurse with them at all times, or is it any kind of nursing services that you said it's designated in the IEP?
Yep. It's identified as a need within their IEP, and so it's usually above and beyond what a school nurse would provide to any student in the school. So it could be to that degree, but it could be other nursing services that are just more intensive. So it's outlined in their IEP and provided from a nurse.
Okay. And then is this the kind of thing where we might look at other companies to provide the services and we review that every once in a while? Or is this a company we've been working with for a very long time and no one has any complaints? Does it provide continuity for the students at home as well?
Yeah. So, yes. You'll notice there are 3 contracts around this tonight. So one is Recover Health, one is Unity Point at Home, and then there are times that students come with us with nursing already established at home. And so to make that a smooth transition for them and a continuity of service, as you noted, that we might partner with that agency to do so. It's also, as in other areas, really hard to find nurses right now. So we do have different companies that we work through just so we can make sure we can find the nurses we need to serve our students.
Director Klein, Jerome.
So is that why we have 3 of these on here? We couldn't just do the first one and cover everybody?
Exactly. There are 2 different companies tonight, but the one way the Unity at Home does the contracts, they do it per individual student.
Okay.
Director Poston.
So I see a standard hourly rate. Do you know approximately how many students this would involve?
Yes. So for the Recover Health, we have 5 students identified now that would be utilizing, 3 students who we have slotted to be utilizing their services at the start of the school year. And we are billed monthly for services.
At that hourly rate?
Mm-hmm. Yep.
Thank you.
Yep.
I'm assuming you're going to cover all 3 of these and have to be individual discussion. So for the Recovery Health Iowa nursing contract, does anyone need any more information to feel comfortable voting on this at the next regular meeting? All right. Next subject for discussion is Unity Point at-home nursing contract, student 1. I'll just turn it right over to you.
So everything we just discussed applies to this one as too. It's just a different company. And as I mentioned, they do their contracts per student.
Any questions on this one? Courtney, you're really knocking this out of the park. The next one, subject 11.03, Unity Point at-home nursing contract, student 2. Are there any questions for Courtney on this one?
Thank you.
You just hammered it home on that first time. All right. Oh, Director Poston.
So this isn't an hourly rate. You said it was per student. So what is that rate then?
I do not have that in front of me. I can find that out for you.
Do you need any other information on that? Does anyone need any more information? And you'll have that for us at the next regular meeting when we're going to vote on it. All right. Thank you. Next subject is 11.04, Michelle's vocational placement contract. $60 an hour. It's $60 an hour on that, Director Poston. $60 an hour, it says on number 9 on there. Yes, it's number 9. Like half the cost I thought it was going to be. Good job. Nice catch. Subject 11.04, Michelle's vocational placement contract. Ms. Weinzero?
Yes, this one is tied to a contract for a full-time coach and one coach for 8 weeks. And these coaches provide job development and coaching that support our students within Project Search. Is there anything you'd like to add, Courtney?
Nope, unless you guys have specific questions.
We currently have this, right? In the program? I mean, this is
Yes. Yep.
Okay, so
Yep.
just keeping it going.
Absolutely.
Gotcha.
Director Beck?
Actually, my question was kind of building on it. This is the group that we've used currently for this service, correct? Like Project Search has used Michelle's MVP.
Yes, I believe for sure it's who we used last year. I'm not quite sure the prior year.
Okay.
And just so you know, we have 5 students in Project Search for next year, to give you that context.
Any other discussion on this? Or any other information you'd like to see before the next regular meeting? All right, next subject is 11.05, building automation upgrade. Jamie, you're up.
Sure. This one is in regards to getting some new HVAC controls upgraded at Central North and West High School. The existing controls are not working at optimal performance, and so we're looking at upgrading those and replacing the upgrading controllers and recommissioning equipment.
Are you guys familiar with building automation is and how it works? If you're not, our building automation is in every one of our buildings. It controls the humidity, the temperature, the air exchange rates, how much air we bring in from outside, how we mix air that's already here. A lot of what we have for equipment, a lot of our buildings is pretty old. So we a lot of times budget like $50,000 a year to make these upgrades. We can do it with a larger amount of money, obviously with the ESSER funds that are available, rather than waiting for them to fail and then trying to scramble to do it when the air is not working in the buildings. We just have to turn the stuff on manually and let it run the old fashioned way and not really mix it correctly. So we're trying to be proactive about it. The equipment that's in some of these places is age expired already. So what we can do with it out of the high schools is take it and put it in some of our inventory. And if a elementary school per se has a same issue, we can take that inventory and help fix that stuff down the road if we need to. The contract we utilized to get the pricing on this was a state contract. It was bid out through the Omnia program in 2020 and sent out that way. Trains used exclusively through every one of our buildings right now. Neighboring districts, I won't say who they utilize, but do the same thing. They utilize one company for it typically. Otherwise, you need to train people to run another program just so you have an understanding of how it kind of works.
Director Beck.
And I noticed that the money is eligible to be used from ESSER funding. Is that because it involves air filtration and air quality?
Yes, this system directly correlates to running our equipment correctly and getting better air quality in buildings. If it doesn't work, the air quality will not be good. Along with this, we're doing a little bit of commissioning work too, so that will help improve some of the air quality in some of the rooms if we test and balance a couple areas and see if it's not working correctly. Put some measuring stations on to see if the flow is correct.
To add the ESSER question, a lot of districts are doing the exact same thing. They're also buying equipment as they need it, depending on their needs. We will have to do a request in our ESSER process to get approval from the state. So before we go too far into this, after this discussion, we'll put an ESSER request for technology that exceeds $5,000. So this will be included in there. So if it gets approved, then we can continue.
You should have approval back before our next regular meeting, right? Because it's 3 weeks out or something. Yep. Okay. Yeah. Any other questions? All right. Up next is subject 11.06 Iasb legislative priorities. I will let Director Poston lead on this one.
Well, we narrowed this down to what you see before you, and wanted feedback from the rest of the board on the, I think we need 4, Brenda, is that correct? So we need our 4 top priorities, and I think for myself, it was school funding policy, supplemental state aid, preschool, and early literacy. But there could be a real good argument also for teacher recruitment and licensure.
And when we started this, I think she noted it. There's 33 of these we had to whittle down. I mean, it's when you look at it, it's hard to say which one's more than the others, but kind of the process we've been running and how we've been geared, that's kind of what we had came up with. So what I would like to do is to go around, and each board member, if you could give us your 4 that you like, and then we can kind of go from there. We'll start with Director Hayes.
I would select recruitment, early literacy, mental health, and supplemental state aid.
Okay. Director Beck.
While I like the idea of the teacher recruitment and licensure, I'm not sold on how things have been going with changing licensure. So I would choose mental health, supplemental state aid, preschool, and early literacy and preschool. Yeah. Although I could see an argument for market competitive wages as well.
Director Klein Jerome.
I wrote down 5, so I gotta look at this one that I'm. I would say funding, supplemental state aid, preschool, and early literacy. I also, though, kind of am leaning towards local accountability and decision making.
That was one of mine too.
Yeah, it's like, yeah.
But those are on the UEN and RSAI too. All right. I went with the school funding. He already gave us his when he did it. Yeah. I went with school funding, supplemental state aid. I did the local accountability too, and early literacy.
Well, I kind of ranked them first early literacy, second preschool, third supplemental state aid. And then I guess I would go, I mentioned teacher recruitment. I would go that way. School funding policy and supplemental state aid, you could kind of lump together. So.
Brenda, I have the top 4 would be supplemental state aid, school funding policy, early literacy, and preschool. Is that what you have? Supplemental state aid, early literacy, school funding, and preschool.
these three. I only did 2 for school funding, 2 for teacher recruitment, 2 for mental health, and then these were 5s.
I just went by how many did he? With Director Potts and Director Gordon not here, do you want Brenda to pull them and see where they're at, and then we'll kind of go from there, rather than break down the one? Okay.
I
Brenda,
would
if you
say
would
as
please
long
do
as
that.
as long as we have the time before we submit these. I don't know when the deadline is for
Yeah,
submitting these, but
because we'll vote on them on the. Yeah, we'll
Oh,
vote on
okay.
the 8th.
Yeah.
Yep. All right, the next subject is 11.07, the rural schools legislative priorities. I will let Director Poston lead on that one again.
So we went through and just ranked each of the either low or from low to high priority. And you want me to read through all these or just let the board look at them?
Has the board all had a chance to look at them?
but could you explain the dots that are already filled in? I don't know who did that.
The the Legislative Advocacy Committee met, and that's where we rated the priorities to kind of give the board a sense. So if you've had a time to review them, if you agree with them, or if you think something should be changed, I'll tell you what, to make it easier, I will just go around and ask each board member if you're good with where it is or if there's any changes you would like to make. And I'll start with Director Kleindrum.
Okay, so the way these are dotted, that was the recommendation on the because when I looked at it, I thought, oh, I can only have 1 7, 1 6, 1 5. I thought I had to rank it down, so I wasn't sure. That isn't the case. Okay. Yeah, no, I'm okay with it.
You're okay with as Director Passion, you're good with it. You're part of the process. Director Beck.
Yeah, I'm good with it. I might lower the formula and transportation equity one to, well, formula equity, but transportation equity to maybe a 6, even though it's extremely important. I feel like some of the other ones are really important as well, but generally speaking, I agree with the choices that you guys made. Yeah, that's what I would have picked.
Whoops. Director Hayes.
I was okay with it. The only question I would do is I might rank the internet speeds higher.
So the reason we didn't do that doesn't affect us. We already have all that. That's why we
With
figured
the
we wouldn't put that.
hotspots and everything.
Yeah.
we have.
Yep.
Okay.
Yeah, we're already set up for that. That's for what were the school districts that he used for the comparisons? I don't even remember, but it's for a little more rural schools that might not have that, whereas we do. Yeah, we're good. That's why we didn't choose that as a priority for Davenport, if that makes sense. Does anyone have any questions on that? All right. The UEN subject 11.08 UEN legislative priorities. these are done in the same fashion as rural schools. So I'll do the same thing again. You all had time to look at this, and I will start with Director Hayes on this one.
I'm okay with this one.
Okay. Director Beck?
Yep.
I know Director Poston was. Director Klein Jerome?
Yep, good.
And then we'll vote on these on the meeting on the 8th, and then we'll get them sent in. All right, we'll move on to subject 11.09, policies for board's first discussion. Director Beck.
As per our more recent process, rather than me reading through each of these and describing what they do, I'm just going to open it up to questions. If anybody has questions on any of the policies that are listed for first discussion, please let me know, or let the policy committee know.
I think we need to discuss policy 600 because there's an option 1 and 2, and you don't want both of them. So we have to decide as a board which option we are heading towards. 1 seems to have a lot more detail to it. So if you would look at those two.
So policy, for people who are not here, policy 600 is called Goals and Objectives of the Education Program, and Iasb has provided 2 template options. It's not necessarily a mandatory policy, but it's generally a good one to have. And if you notice, the one that's up on the screen now is option 1, and as Director Klein Jerome said, it's a little bit more specific about how we let's see, sort of what types of opportunities we strive to provide for all of our students. And the option 2 is fairly generic and say that we establish educations annually, but it doesn't list what those objectives are. And Director Klein Jerome, you said you liked option 1 with the list. Yeah. And I would note that this doesn't limit us to just these things. It just kind of highlights some of the things that we think are important as a board.
Director Poston.
Number 306, succession of authority to the superintendent. We've had this discussion before. Do we need to have it be more specific as far as who does actually fill in the absence of the superintendent?
So we have had this discussion, I believe as a whole policy committee, that
we actually talked about this at the last meeting.
Yeah,
and
that's what I was
you
going
were
to
out of
say.
town.
Yeah.
Director Klein Jerome, you want to take that one?
Yes, we did discuss this. TJ is more comfortable not designating a specific person, and that, you know, if he is capable of doing it, they kind of rotated around. Even when we had associate superintendents, they rotated it between Rob and Bill or whoever was in there before that. And so that it would rotate. Well, Jamie has stepped in here tonight. And if there was some reason he couldn't do it, then that would be a board decision, who we want to step in and fill in until he is back, or whoever is our superintendent. So he is more comfortable not having a specific name in this, and it gives us some flexibility as well.
The idea being that it would be somebody from the cabinet, but if something super catastrophic occurred, then the board would meet to designate who would be the interim superintendent from the eligible pool of people.
And then I think at the very least, then I think there should be in there that it would be someone from the cabinet.
I thought it just says administrative, doesn't it?
Yes. We do have, well, if we're going to designate an interim, the person who's designated has to have their superintendent's license. But if it is just for filling in, kind of like now, it doesn't have to be somebody who has a license. We can certainly distinguish between those two if you want in the policy.
Just a little background from previous. If you name someone and then someone doesn't, I don't know how I want to say this the right way. It's not in their wheelhouse, then you have hurt feelings between people, and then it makes for a bad working relationship with the people on that level. But I mean, we could certainly have it say something with, it needs to be a person of the cabinet, but like Director Beck said too, it depends on who has their superintendent licensure. If we put that person, you or the interim superintendent, they would have to have those requirements to meet the law.
Although right now, I mean, if it just said responsibility of the other cabinet administrators, like Jamie stepped in, she does not have her superintendent's license. She doesn't need that to step in at this point. So I think just putting in cabinet allows, again, some flexibility on who can do it.
Does that kind of get what you're looking for, Director Poston, to put
That's fine.
Okay.
Just add cabinet in front of administrator?
At the in that first sentence there, or yeah, it is the responsibility of the other cabinet administrators. Okay.
Okay.
All right.
Cabinet level administrators?
Yeah. We can figure out the best way to word that.
Okay. Back to, or is it still on this one?
No, go ahead.
Back to the one we were talking about before that, the 600. If you could, Director Beck, make sure you pull everybody to see if they like option 1 or 2, so then we know going forward where we're at. Because we started that conversation and then we went to that one. I was going to stop for a second, but we rolled it through and got that done. But if we could go back to that and then figure out who likes option 1 or 2 and kind of pull that so we know going forward with that one, please.
Okay. So Director Klein-Jerome, you said option
1.
Okay. Director Poston, option 1. Director Hayes?
1.
And Director Gosa? Okay. And I prefer option 1 as well.
I have one other question. Kevin, could you answer 709? It was a fill in the blank, but the blank now says 50,000 / 100,000. Could you explain why there's 2 amounts in there?
Absolutely. There's two different deductibles when we have an insurance claim. One is for an act of God. The other would be like fire, flood, vandalism. That's why there's a 50,000 and 100,000. One has a lower deductible than the other. So this is in reference to what matches our actual insurance policy.
So do we need to explain that in that paragraph? Insurance of buildings, structures, and property in the open will not generally be purchased to cover loss exposure below 50,000, 100,000 for acts of God or whatever.
I would suggest you put it per the insurance policy.
Oh,
because
okay.
the policy itself states those.
Okay.
That'd be a lot simpler.
And flooding is not an act of God?
Depends what it is.
Oh,
you could have a water main break that has nothing to do with it, just wore out and it flooded a basement. Or you could have an actual flood, which is an act of God. So it depends.
Okay, how it happens would be.
Exactly.
Yeah, okay.
Insurance lens.
So it should say on there per the insurance policy?
Yes.
Then? Okay.
Brenda, did you get that? Okay. Yeah. Yes, and I would say it's our capital assets manager that does that. So we should, or we could put superintendent or designee. You want to do that? Superintendent or designee?
That's
Okay.
why we've written all the others.
Yeah. Okay. All right. Any other policies people have questions on? 705.01, the purchasing bidding. Okay.
Just explain what this was all crossed off here. What's going on?
You guys, I think you guys did this one when I was out of town as well. Director Kleindrum?
I think this is actually a Josh and Kevin question on the purchasing and bidding.
What was the question? I did not hear that.
There's like 5 or 6 lines that are crossed off, and I'm just curious what the reasoning was there, or what's going on there. It says prior to August 15th of each year.
That has to do with dealing with targeted small business. Yes, we have a targeted small business law, but there is no reporting that goes into that. So that was old language from when they started targeted small businesses. Vendors had to enroll, and then school districts had to submit a report to the state of the activities that they had done with the targeted small businesses. So it's more of, we have to have language in here that we will encourage people to use targeted small businesses, but we don't have the reporting piece of that any longer.
Does that answer your question, Director Pasha? Okay. Any other questions? This is the first round ones, right?
Mm-hmm. Yeah, so these will come back for a second discussion at our next regular meeting. We'll make the changes that people suggested as a committee, and then they should be back then.
Seeing no other discussion on that, we will move on to subject 11.10, board policies for board second discussion. Director Beck?
Yes, so we saw these policies at our last regular meeting. So this is the second discussion. If anybody has any questions or comments.
Whizzed right through those.
Yep, then they'll come up for a vote at our next regular meeting.
Perfect. Thank you, Director Beck. Administrative reports.
None at this time.
This is your opportunity. Just get it out there.
I have a lot to say, but
Jamie, could you tell us like how is hiring going? And at this point we're about 30
yes. So we are processing a lot of candidates. So our process this year, what we did was to, when we received a recommendation for hire, we do a contingent offer, which isn't something that we had done in the district in the past. So we let the candidate know that we want to hire them pending their background check, their references, and their licensure. One thing that was interesting when you were talking about some of the legislative topics is licensure. We do have a lot of candidates. We're a border state, so we're competing with Illinois, and we have quite a few candidates that have accepted offers, but it's like a 3 to 4 week turnaround time for them to get their Iowa licensure. So with that, we do run some risk of people staying in Illinois. I mean, the market's so challenging right now. And then also, there's an old administrative reg with some requirements that are slowing down our process. So we're going to update that and take out some pretty stringent requirements that aren't necessarily legal requirements.
Can I ask a follow-up to that? So is there a window for certain positions where a person can work for, say, 2 weeks pending licensure or something like that because of that lengthy turnaround time? Or is it we can offer them a position, but they have to be fully licensed before they start in all positions.
So they have to be fully licensed before we allow them to sign a contract. What we did last year and what we would be willing to do is if it's getting close and the Board of Educational Examiners says they're, close to getting them their licensure, we do let them come to new teacher induction, because that's run through TLCS, and we'll bring them in as a temp at will, so they at least get all of that. But we are, we're chugging through them. We've got like 70 teachers worth of application materials, but we still have a lot of openings, but we're still getting recommendations for hire every day. So I looked at the last 5 years trends, and we still seem to hire people up until the last minute. So yeah, it's a challenging environment right now. So the teacher recruitment and licensure, it's becoming very competitive with the other districts in the area.
Thanks for the administrative report. That was great. Board requests. Are there any board requests? Seeing none. Board reflections. Director Hayes.
I enjoyed the CHC presentation. I like the fact that that will certainly help a lot in attendance, and I think with someone on board like that, rather than waiting these long times for physicals or shots or whatever it is, as hard as it is to get into a doctor's office, I think that would be a real asset to the district to help with the attendance.
Thank you. Director Kleindrum.
I also think it's great that the community health, it worked out at SMART, and so that we are expanding it. That's good to hear. I kind of wonder why we didn't include Walcott Junior High, since we seem to have picked up all the other junior highs, but at least we are expanding. And I want to thank Jamie for stepping in and filling in at our board meeting.
Director Poston.
Yeah, I'm wondering maybe Jamie should be working on her superintendent licensure. Just like everyone else, the community health care partnership, I think that's so important, not only to the school district, but also to the community.
Thank you, Director Beck.
I also agree with the community health partnership, but I was really thrilled to see how similar we all are in terms of the legislative priorities for all the different surveys. We all seem to have basically the same ideas for what we think that our lobbying organizations or advocates should lobby for, and I thought that was really impressive.
Oops. Cabinet Member Weinzero.
Thank you for asking. I would also, my board reflection is around community healthcare and how much of an asset that's been at SMART, and the opportunity and the amazing technology and having the telehealth doctors and being able to bring all of that to our kids and helping those families that are working hard and can't necessarily get out of work to get their child to a doctor. So I think it's amazing technology, amazing ways to help our community. And I look forward to them reaching our other schools in the district.
Thank you. I agree with everyone else about the community health care as well as the priorities. There's a ton of priorities, and I wish we could do them all, but you can't. I'm going to go with my baby, the Traveling Trophy Award. I really love that thing. I think it's awesome, and it really gets everyone engaged. So I thought that that was great. I'm glad Corey could be here for that. And congratulations again to Wes for winning it this year. So with that, I will entertain a motion to adjourn.
So moved. Although we can't technically, like Director Poston said, Potts
I
isn't
know. I
here.
was trying to figure out who I was
This
going to
is a
call.
problem.
Yeah.
Yeah, but I so moved.
Is there a second?
Second.
All those in favor say aye. Meeting adjourned.